Hey folks, welcome to TacMed TV. Today we're going to talk about ticks, tick-borne illness, prevention, and how to remove a tick. Coming up next. Hey folks, welcome to TacMed TV. My name is Steve, and today we're going to talk about ticks. Now, originally when I started working on this video, the concept for this video, we were going to talk about the mosquitoes and the harvest mites and ticks and things of that nature that we encounter on a call out that a lot of times we don't really think anything about. And once I started doing the research for it and started getting into what I was going to give to you, what information I was looking to give to you guys, I got on the tick subject, and there's just so much information. CDC has a complete section dedicated to ticks, and incidentally that's where a lot of this information came from. Plus I will put a link to that CDC webpage in the description below, and may even put a banner up right here so you can go to it. So anyway, there's just so much stuff on ticks that I felt needed to be covered, so we're going to do that. So first of all, we're going to talk about the different types of ticks that are in the country. You've got the and there's a bunch too. I didn't realize there was this many different types of ticks just where we are in the United States. But you've got the black-legged tick, which is in the eastern United States. You've got the Lone Star tick, which is in the eastern United States, predominantly in the south. You've got the American dog tick, which is in the Rocky Mountains and the Pacific coast. You've got the brown dog tick, brown dog tick, that is worldwide. You can find that sucker everywhere. All right, the groundhog tick, which I'd never even heard of before, is in the eastern United States. You've got the Gulf Coast tick, which is in the southeast and mid-Atlantic states and southern Arizona. Sounds like somebody took a vacation and brought some ticks back with them. The Rocky Mountain wood tick, which is, guess where, in the Rocky Mountain states. The soft tick, which is in the western US and Texas. And then you've got the western black-legged tick, which is on the Pacific coast. Again, this is information from the CDC website. I'll put the thing and direct you that way so you can check what they've got out, because they're going to go into a lot more detail than what I'm able to do right here on the channel for you guys. This is just a primer to get you thinking about it. So let's talk about a little bit of prevention, because you know prevention, an ounce of prevention is worth a pound of cure. So the prevention with ticks and tick bites is, what uniform adjustments do you need to make for your team? All right, you're going to be outside. Maybe you're doing tracking, or maybe you're doing your sniper observers. Those guys are going to be crawling through some stuff maybe that they need to be, you got to deal with the prevention with them, make sure they're doing whatever they need to do. And one of the things is just know where to expect to see the ticks, okay? But make sure you make your uniform adjustments. My thing is, blouse your trousers, okay? Blouse your trousers into your boots. That keeps the creepy crawlies from crawling up your leg and then biting you, okay? That's just my thing. That's something I do during training, and it's something I do during call outs as well. And I encourage the rest of my teammates to do the same. But know where to expect them. If you know you're going out to the range, and the range is basically like a park, it's grass and trees and things like that, then you know that there's probably going to be ticks out there if it's warm weather. Okay, so you need to make sure that you've done those adjustments, and that you know that they could be exposed to ticks out there. So treat your clothing is another thing that you can do. Treat your clothing and your gear with 0.5% permethrin, I think is how you say it, permethrin. Yeah, permethrin. That's how you say it, I think. Not really sure. But once you treat your clothes with that and your gear, it lasts for several washes. Just follow the can, whatever it tells you, how to apply it, and so on and so forth. Again, this is on the CDC website as well. Now for your person, when you're out on the mission, make sure you're using an EPA registered repellent, something that's got DEET, picaridin, I think is how you say it, picaridin, I think is right. IR3535, oil of lemon eucalyptus, or paramethanediol. I think it's that, paramethanediol. I think is how you say it. Not really good at pronouncing all these chemical compound stuff. So they can't just give it a regular name. I'm sure it probably does, but I don't know what it is. So anyway, now the thing with repellents is if they're under 2 months, if they're 2 months old or younger, do not use any kind of repellents on, because this information, I'm sure we don't have any 2-month-olds on a team anywhere, but this is information that we take home with us as well, okay? We don't leave our knowledge at work, okay? So this is stuff that you take home. So when you're using repellents, don't use them on babies 2 months old or younger, okay? Just don't do it. It's not recommended at all, period. And then if the oil of eucalyptus, the oil of lemon eucalyptus, and the paramethanediol, don't use those on children 3 and under, okay? 3 years of age and under, okay? Don't use any repellents if they're 2 months old or less, and don't use the oil of lemon eucalyptus or the paramethanediol if they're 3 years old or younger, okay? Don't use it at all. And then of course their last, I thought this was great, the other advice they had for prevention is avoid ticks. Like we have that choice, you know, the job dictates where we're going to go and how we're going to do that. So we've have to, as medics, our job is to mitigate the risk for our teams, okay? So that's how we do this. Uniform adjustments, prevention, make sure that they've got the insect repellent, the proper insect repellent that they need to use, and go that route. The other part of prevention goes on the back end of the call out. Once you're done, is tell them, look over themselves, look over your buddy, make sure there's no ticks on you, especially if you've been somewhere where there probably could be ticks on you. Just do a sweep, okay? Just look, have your buddy look you over and make sure that you don't have any ticks on you, okay? All right, and then the other thing is, when you get the chance, strip down, do a body check. Make sure that you don't have any ticks on you. Make sure you look in the hair and the hairline, ears, armpits, groin, behind the knees. Give yourself a good looking over to make sure that you don't have any ticks on you, okay? And take a shower as soon as you can. Go ahead and shower off. If you missed any and you wash one off, then he'll go down the drain. All right. Now, canine officers, because sometimes we do work with canine officers, you've got a little bit different thing there. As far as you, I can tell you all day long, this is what you need to do. You need to follow what we're doing. All right. For your canine partner, your police dog, talk with that dog's vet. All right. See what that vet wants to do to prevent tick bites, fleas, whatever, mosquitoes and everything from getting on your canine partner, okay? That's the route you need to go. Talk to your canine's vet. Now, real quick, I'm going to go ahead and cover removal right now, and I'll come back to it again if I need to. But if you've got one, if you do all that and you find a tick that's embedded on you, the next thing you want to do is get a pair of fine-tip tweezers, really fine-tip tweezers, okay? Get as close to the skin as you possibly can with those tweezers. Grab a hold of the tick and lift straight up, okay? Steady, even pressure, pulling straight up, all right? And that should dislodge the tick. Now, once you get that done, inspect the site. If you see any little mouth parts or anything in there, you can attempt to get those. If you can't get them, CDC site recommends that you just clean it with alcohol or soap and water and let it heal, okay? And I guess their thinking on that is the body will work it out. I'm not really sure. My thing would be, I'm going to call my doc, my medical control, and see what they want to do at that point once we've removed the tick, okay? See how they want to proceed with it. They may want to go down a road of prophylactic antibiotics or something of that nature. I'm not really sure. So it's just one of those things. Consult your medical director and see what they recommend at that point. But make sure after you've removed the tick, you clean it with the rubbing alcohol, like I said, or soap and water, and tell your operator or whoever it is that's got the tick, make sure that they're looking for signs and symptoms of infection. And we'll talk about that here in just a little bit when I go down the list of the tick-borne illnesses, of which there are a bunch. Okay, I didn't have any idea there was so many. So as well, let's just go into that right now. The tick-borne illnesses that could be caused by a bite, you're looking at anaplasmosis, babesiosis, Colorado tick fever, which is not to be confused with Rocky Mountain spotted fever. It's a whole separate thing, but it's in the same family. I think it's a rickettsial disease, I believe. Ehrlichiosis, Heartland virus disease, Lyme disease, Powassan disease, Rocky Mountain spotted fever, rickettsiosis, tick-borne relapsing fever, and tularemia. Tularemia. So a lot of these words are $10, $20 words here, okay? You're getting your money's worth today. So anyway, some of the common signs and symptoms with all of those are fever, malaise, just not feeling good, joint pain, soreness all over. It's a type of just general myalgia, nausea and vomiting and diarrhea, and of course a rash. If any of those are seen, go see your doctor. Get your operator to their primary care physician, to the team doctor, whoever is that person's medical provider. Get them to that person. Make sure that they understand that, hey, here's a tick bite, this is what went on. And the thing about it is, the incubation period for a lot of these diseases are anywhere from a day to a couple of days to a month to 9 weeks. I know, right? So there's a long time there that things can happen that you've got to watch if you have a tick bite. So it seems like most of the treatment for tick bite is antibiotic therapy. That seems to be the thing, but you've got to find out, okay? And make sure, if you run into something like this, you get a tick bite, you're watching for signs and symptoms of infection, and you start having some of those symptoms, that you do go to your provider and you make sure that they understand, like, hey, I had a tick bite, here it is, here I got bitten by a tick right here, and show them, say, hey, this is what I'm worried about. Talk to my team medic, and he was like, hey, yeah, this is why he needs to come in, that kind of thing. Something I even do for my guys, if they need me to, I'll call and make them an appointment, with their doc, and tell them ahead of time, hey, this is what I think's going on. Or if it's advanced enough, I'm going to send them straight to the ER, and just go that route with it. And that's just what I'm going to do. So anyway, but again, I'll put the CDC website on ticks in the description box below. Go check that out, because this is our responsibility, okay, to take care of our officers, and this is part of taking care of our officers. This is something that I don't think it ever hardly gets talked about in the tactical medic community, what our responsibilities are, and this is one of those responsibilities. Now, coming later, I'll probably do something on the mosquitoes and the harvest mites and things of that nature. Really and truly, this is something, though, that needed to be covered, especially, we're coming into fall. Where I'm at, deer season's getting ready to kick up, so people, I think we've got another turkey season coming. People are going to be out. They're going to be in the woods. So take this information with you, okay? Go to that CDC website, learn about the diseases, because I didn't even go into what each one of them does, and what the specific signs and symptoms of each are. That's something that you need to do on your own. You need to engage your brain. I'm just here to give you topics and to get you started on a basic path, and then it's up to you to finish out that path, do your own research. I think you learn it better that way, and then apply it to however you need to with your team. Do it when you're doing your job, okay? So with that being said, a few other things I want to talk to you about. End of October, 29th, 30th, and 31st, November 1st and 2nd, we've got EMS World Expo 2018 coming up in Nashville, Tennessee. We're going to be there. TacMed TV is going to be there. We're going to be, I think we're pretty much going to be there all week. At least that's the plan. Even through some of the pre-conference stuff, we're going to be there all week, man. We're going to be shooting videos. We're going to be talking to people. We're going to be in the exhibit hall. We're going to be talking to vendors. We're going to be talking to attendees. I'm going to work on trying to maybe get an interview with some of the keynote folks, and to see if we can maybe work that out and talk to them a little bit. But we're going to have a lot of fun. So if you see me down there, or you see any of the TacMed TV people down there, there's going to be probably, I think, 4 of us down there you're going to get to meet. Of course, Jim Williams is going to be there, and then I've got 2 others that sometimes work behind the scenes with what we do. You're going to get to meet them as well, and we'll wait to introduce them till we get down there and start shooting video. I'll introduce you to those guys because sometimes they're a little camera shy. So anyway, with that being said, find us. We're gonna be easy to find. Who knows, you find us, I'm gonna try to have a bag of swag. You might end up with a hat or a t-shirt or something else, scissors, pens, whatever. Come by and find us and say hi to us, because we would love to meet you guys, okay? Without you all, we don't get to have this channel. If you guys aren't watching, we aren't making a channel. So anyway, thank you so much. If you like what you saw in this video, hit the subscribe button and the little bell icon next to it. That'll give you the notifications when a new video comes out. It'll let you know, say, hey, new video from TacMed TV, go watch it. So please do that. That means the world to me, to know that you care enough to say, hey, you know, he's giving out good information, I want to watch this. So I appreciate that. Also, hit the like button and leave me a comment. If you come into contact with stuff like this before, or if you've got a topic that you think that you would like me to cover, that you think is imperative, or something that you do with your team that works extremely well, let me know, man, because this is a community we're working on building here, okay? There's only a few of us around that do this type of work, and we've all got to kind of be there for each other. So if you've got an idea on something, let me know. I'll do the research and I'll do a video for it. If you don't like the video that I just did, tell me why. Tell me why you didn't like it, because if I'm not getting the criticism, if you're not telling me, then I can't change it. I can't fix anything. I can't make it better. I can't make it a better experience for you. So please help me out. Just please be constructive with it. So anyway, with that being said, again, EMS World Expo 2018 is coming up. We're going to be there. Hope to see you there. And until next time, my name is Steve with TacMed TV, telling you guys to stay safe.